Hey, what's up, guys? Welcome back to another video. As you can see, I'm in business casual wear, sitting in a little office, and I'm here to talk about my new job, actually. So, in my prior video, you saw that I was doing a travel position in Texas. I had filmed that actually like way in advance. I've actually been back in Arizona now for about 2.5 months, and so during that contract extension, or that assignment I had in Texas, I had the option to do an extension, or I was going to try to find a new job elsewhere. So, and I don't know, I didn't know what I wanted to do. It was either going to be go back to the hospital, but if I did go back to the hospital in Arizona, I was not going to be a staff employee anymore. I was going to probably go like float pool, just get paid more per hour. So that was my goal. And otherwise, if I didn't decide to do that or find another position elsewhere, then I was just going to continue with another extension in Texas, because again, Texas was phenomenal. No complaints about that assignment at all. So what ended up happening was, while I was in Texas, I flew back to Arizona for a wedding reception. And so I get there late, and then I go sit down at a table, and I start talking to this couple, and we just start talking about like what we're doing for a living and stuff. And I meet this guy, and he's like, "Oh, I work for this company, and we work with cancer patients, and we have like leading technology. They do interventional procedures." And so that kind of piqued my interest, because they're not your traditional chemotherapy route, right? Like, no, they do things completely different. They do genetic testing to match the chemotherapies up with each patient. So no one patient is going to get the same treatment, because we don't have the same DNA. So I thought that was actually really cool and very different. And so I fly back to Texas, and I start thinking about it. I'm like, oh, that sounds kind of fun, because I kind of wanted to get out of the hospital just for now, because that was a little break, to try a different field, try something new. And so I really started thinking about it. I'm like, screw it, dude. Let's just apply, see what happens. So I applied to the company. The guy I'm at the wedding, he emails me back, and he says, all right, I sent your application over to HR. And I was like, oh, okay, cool. So like 2 days later, I'm in Texas, and I'm studying. And so I get a phone call from the company, and like, oh, hey, we want to schedule an interview for you. And I was like, oh my gosh, already? But then I told them, I can't. They wanted me to come do the interview in person, and I was like, I can't do it, because I'm going to be in Texas for another 2 weeks until I fly back down. And so they actually said that was okay, and so they waited for me. So, long story short, I do the interview. I do 2 interviews, and I end up getting the job. I'm like, cool. So then I'm like, I got offered the position, so I'm not going to go through with my contract extension that I have in Texas. So I'm pretty excited. My first contract in Texas ends, so I flew back to Arizona for like a little break, and then I fly back to Texas to go pick up the car, and I drove straight home. So I started with this new company, and it's been so amazing, because the company has been around for a long time, but they wanted to do their own interventional radiology in-house. So like when I got on board, I like helped them open. I'm like helping them write procedures. We're ordering products. We're getting the operating room set up, the PACU pre-op bay set up. And I'm like, I've never been in a position like this before in my life, and it's been so cool. It's cool to see the business aspect of things. And one thing that I really understand now is, like, in the hospital, they're kind of like really cost effective and stuff. I'm like, yeah, blah blah blah. And because you just have everything you need, and you don't know how much it costs, where it comes from. And so now coming to this place, seeing like how much things cost, because we have to order all these things, and now I really understand that, okay, the hospitals aren't being that greedy necessarily, because things add up so fast. So I now understand like why they want to try to be more cost effective. And so the experience has just been excellent. And so I now am a registered nurse in interventional radiology, and IR also is known as an abbreviation for it. It's always been on my list of things to do, in nursing, I just didn't think it would happen this fast, let alone there's no way I thought I'd be working with cancer. So like cancer, I'm not gonna lie to you guys, I really didn't know much about it. Cancer was never like an interest in me at all. And then once I got here and I heard like what they do, obviously I know more about it now. And the fact that they have people that couldn't walk and now can walk, run, hike, and 90% of the patients probably have their hair. You just see different results here, and it's amazing. All of the doctors here are naturopathic doctors, but we also use conventional medicine, so we do holistic care. So you have Western medicine, you have the naturopaths, and we combine it. So they come to us, to this side, to get the procedures done. So just as an example of what a procedure is, if they have like a tumor on the liver, okay, well, rather than getting IV, going through chemotherapy orally, feeling terrible, looking terrible, hair loss, what we do is we actually create, and the company actually has their own pharmacy as well. So we create patient-specific medications. And so they do genetic testing, and they test their biomarkers. So we can find out your biomarkers, and we say, okay, these are what we need to attack. So they literally create a specific drug for that patient to attack those exact biomarkers. So if they have a tumor to the liver, they come to us, the interventional side, and so we put them on the table in the operating room, and the doctor, he'll get access to the liver, and he will deliver those specific medications straight to that tumor. And so I'm like, I didn't even know that was really a thing. So the fact that, and yeah, there's great results so far, and and it's actually more cost effective. If you go to the hospital, you're gonna get the same thing over and over. Us, we just do, this is what you need, and you're done. So it's just been super eye-opening, and we do other procedures such as like Cryo Ablation. If you have a tumor, like I say, in your kidney, we did one procedure where it was actually the breast tissue, and so we went in with a rod, and we went to the tumor site, and we froze it, and you thaw it, and then you freeze it again, and I've never seen anything like that before. Also really cool procedure, and we have so many more. We're kind of just doing like since we just opened only 2 months ago, we're just kind of like limiting the amount of procedures, and then until we like completely open it. So just what I've seen so far has been super fun, very fascinating, very educational. But it's just just like a reminder, like there's so many opportunities and things you can do in nursing. So I just encourage you guys, get out there. If there's something that you want to try, if you're tired of like doing the same thing over and over, even if you've done it for 1 year, all right, go try something else. Like, you're never gonna run out of options. You keep on pushing on. And so that's like a little background of what I've been up to recently. I know that my videos might be jumping all over the place. Like, I was just in Texas and I was at another hospital, but this is my new job, working IR. I'm probably gonna stick this out for a while because it's been super fun. Again, it was one of those things I had on my list of things to do as a nurse. And then, so I'm just gonna give you guys a tiny quick tour of our facility. We actually are in a smaller building that they just opened, but we have construction going on for an entire new building that's gonna have like 7 pre-op post-op bays, got a CT machine, and we're gonna have like 3 operating rooms. So like what you see here is just literally temporary, and we might even go to another building because we're growing so fast. So again, I couldn't be more thankful for the opportunity that I have, that's been presented to me. I'm taking it, running with it, trying to learn as much as I can. But it's been really fun. So let me take you guys on a quick little tour of like just what the current setup is, if you're not familiar with like what a OR or interventional room may look like. I'll just run you through there, and then we'll just wrap it up. So here are our pre-op and post-op bays. There's only 3, but again, we are building a whole new facility. And if you walk through these doors here, just really quick, you'll see that we have our procedure table, we have a C-arm for live imaging x-rays, we have our medication cart, in-class cart. Underneath these Racks cover are a whole bunch of medical devices such as wires, catheter placements. You have another one on this side as well. Here's just kind of an example of some of the tools that are used to gain access to patients to get to where we need to go. So we have some catheters here, we have some dilators, we have portacath placements, tunnel catheter placements, just a barrage, an array of things. But that's basically it for this video. Just kind of wanted to take you guys to work, give you an update of what I'm actually currently doing. Thank you guys again for watching, subscribing. It's been great. Leave comments, feedback, questions, concerns. Until then, I'll see you guys next time.